Hello, my name is Jose Barrientos, and I will be discussing busting bias, identifying and minimizing bias behaviors in the workplace. We are Group 8 of LHRD 7305. This presentation was done in collaboration with Lakeisha Alexander, Gabriel Diaz, Carrie Lara, and Rebecca Seaman. In her 2019 article from Design Management Review entitled Moving from Unconscious Bias to Inclusive Leadership, Dr. Shirley Davis states that everyone has biases. That acknowledgement is the first of many steps into busting bias. Additionally, Kim Scott explains in her 2021 book, Just Work, that bias comes from the part of our mind that jumps to conclusions, unusually without us even being aware of it. Leaders have an obligation not only to correct bias when it happens, but also to look for opportunities to prevent it from damaging relationships, impacting good decision making, and stifling inclusion of people within an organization. This presentation will provide you with a plan for proposed training to help leaders identify bias within themselves and those around them, and also give the tools to address bias and provide them with the opportunities to practice their newfound skill. The team used 8 sources to develop the training material. Francisca Gino and Catherine Kaufman's 2021 Harvard Business Review article, Unconscious Bias Training That Works, outlined key elements that ensure successful training. Shirley Davis's article, Moving from Unconscious Bias to Inclusive Leadership, focused our content on leaders' behaviors with an eye on ensuring those behaviors can be translated into the workforce of the future. Kim Scott's book, Just Work, and the book Crucial Conversations by Joseph Grenny and Carrie Patterson provides practical insight into how leaders can help their organization identify and talk in a meaningful way about their bias. The articles, How to Identify, Understand, and Unlearn Implicit Bias in Patient Care, and Making the Invisible Visible, explain how to overcome implicit bias by first identifying your blind spots and then actively working to eliminate stereotypes and attitudes that negatively impact your relationships. We also use the textbook Diversity at Work, edited by Bernardo Fredman and Barbara Deanne, as a framework for our training material. In order for leaders to be successful through implicit bias training, there are several contexts to consider when ensuring the transfer of knowledge through training, such as what industries would be appropriate for this training. Also, what industry will be focused on this training. Next, what type of tools are needed. And then lastly, what qualifications are required for the trainer. Implicit bias, unfortunately, happens everywhere, which is why industries should incorporate this training for their employees that will be interacting with each other, clients, potential clients, and any other visitors that they would come into contact with. In their 2018 article entitled Exploring the Relationship Between Diversity Intelligence, Emotional Intelligence, and Executive Coaching to Enhance Leader Development Practices, Janelle Whitmer and Margaret Hopkins discussed the results of a study performed on 10 individuals, all in the executive leadership position in industries including healthcare, finance, higher education, law, manufacturing, information technology, and retail, that displayed a considerable amount of diversity intelligence. The participants included men and women, different ages with approximately the same average work tenure, and their different geographic regions across the nation. According to Whitmer and Hopkins, 97% of the group agreed that crucial aspects of emotional intelligence are emotional self-awareness and empathy, and are critical for diversity intelligence, adaptability, flexibility in their organizations. This speaks volumes on the need of diversity training sessions such as unconscious bias in the workplace of all the industries, and is why it is essential in every aspect. For the purpose of this training, we will limit the audience to the healthcare industry. In 2016, the Joint Commission gave examples of situations in which implicit bias has presented itself in the healthcare industries, which include non-white patients receiving fewer cardiovascular interventions and fewer renal transplants. Black women are also more likely to die after being diagnosed with breast cancer. And lastly, non-white patients are less likely to be prescribed pain medications such as non-narcotics and narcotics. Other contexts to consider are the tools and the qualifications of the trainer that would be appropriate for this type of training. In Whitmer's and Hopkins' article, based in 2018, they stated that a leader, as well as any other person, must have self-awareness. This is how you recognize behaviors and needs. To do this, it would be recommended for leaders to participate in the implicit association test. The implicit association test was developed in 1998 by Harvard University, and according to Elizabeth Gatewood, Cindy Broholm, Jenner Herman, and Charles Yingling, the IAT is used to determine implicit biases on topics such as race, skin tone, weight, sexuality, Arab, Muslim, and age. This tool can be utilized for self-awareness of unconscious bias in the workplace. Leaders can take those results and take a step forward to correct those biases. Leaders will use this to grow and move forward with inclusive leadership. In order to deliver the training content in a way that will impact the leaders to learn and engage, the qualifications of a trainer should include certification as a leadership coach, subject matter experts in diversity and inclusion, 15 plus years of experience of training at all organizational levels, and lastly, possess characteristic traits that include inspirational, relatable, compassionate, trustworthy, and also being authentic. This course's primary goal is to provide leaders tools to help them recognize, address, and prevent bias. To accomplish this goal, the following objectives will be covered. The participants will be provided with the definition of bias and understand the difference between bias and prejudice. We will give the participants some scripted scenarios and ask them to determine whether the situation is demonstrating bias or prejudice behavior. They will then be asked to reflect on their own biases and discuss with their learning partner. The final two objectives focus on how leaders can help address bias when it happens and how to talk to employees to help them recognize and avoid their own biased behaviors. The course will be taught in a classroom large enough to fit 16 to 20 students in pods of 4 to 6 people. The room should have an overhead projector connected to a computer to allow for display of the PowerPoint presentation with key information to share with the class. The course is expected to take approximately 3 hours with 10-minute breaks every 50 minutes. The purpose of the activity is to reinforce the concepts presented in the training and to provide students with the opportunity to practice new skills in a safe environment. The handouts that include scenarios will be provided to each student. Paper and pens will be supplied to all participants for note-taking purposes. In the next few slides, I will provide additional details of each of the following activities. In their 2019 article, How to Identify, Understand, and Unlearn Implicit and Bias in Patient Care, Jennifer Edgoose, Michelle Quiog, and Kartik Sadir define bias as an unconscious collection of stereotypes and attitudes that were developed towards a certain group of people. And in her 2021 book, Just Work, Kim Scott differentiates prejudice from bias by explaining that prejudice is when people consciously believe stereotypes to be true. In Objective 2, we will provide some ways to differentiate between bias and prejudice. Because unconscious bias is more difficult to identify, we'll focus most of our attention on this behavior. Scott explains the 9 ways that bias can be present at work. 2 examples include making incorrect role assumptions and using names and gender pronouns incorrectly. Prejudice may show up as judging a mother who works outside of her home, as deliberately passing someone over for a promotion based on race, or not hiring an old person because of their age. In Objective 3, the first activity of the class, we will provide a series of short scenarios for participants to review with their partners and determine whether the scenario demonstrates biased behaviors or prejudice. The participants will be asked to discuss with their partners what makes them believe the scenarios were either bias or prejudice. Once the participants have completed the exercise, the facilitator will lead a debrief with the entire class to hear what the participants learned. This exercise is expected to take approximately 20 minutes. To best understand bias in others, we must first acknowledge what our own biases are. In Objective 4, we give the participants an opportunity to reflect on their own biases by having them complete a selected implicit association test. We anticipate this part of the class to be uncomfortable for some people, but we feel that personal reflection is a necessary part of the process. In this exercise, we will provide the participants with a list of 9 common biases discussed in Objective 2 and ask them to take some time to reflect on their own past actions, conversations, or attitudes towards coworkers or even in their own personal lives to identify times when unconscious biases may have impacted their behavior. They will be asked to share at least one of their examples with their partner. Once the participants have completed their personal reflection and discussion with the partner, the facilitator will conduct a debrief by asking if any of the participants would be willing to share their bias. As part of the debrief, the facilitator will share a personal bias behavior to show vulnerability to the participants with the intent of starting the conversation. This exercise is expected to take about 30 minutes. In the 2012 edition of Crucial Conversations, written by Patterson, Graney, McMillan, and Switzer, a crucial conversation is defined as a discussion between two or more people when stakes are high, opinions vary, and emotions run strong. In settings where a leader needs to address bias in the workplace, all three of these elements have the potential to exist. The damage and unaddressed bias behavior can do to co-workers' relationships are that the high stakes opinions on whether the behavior is bias or prejudice may need to be addressed. All of the parties on both sides of the bias may get highly emotional. The company Crucial Learning provides a focused 2-day class to dive deeply into a full set of tools to conduct a crucial conversation. This class, we will only introduce two concepts: make it safe and state my path. In the concept, make it safe, a leader's first goal is to identify a mutual purpose or a common outcome. To do this, a leader needs to approach the conversation with respect and sincerity. In this case of correcting a bias, a potential mutual purpose is to prevent damaging relationships with coworkers. The second concept, state my path, will teach the leaders to share the facts, tell their story, ask for the employee's facts and story, talk tentatively, and encourage testing. Notice this spells the acronym STATE. For the third activity, to support Objective 5, the participants will be asked to work with their partners to practice providing feedback to each other using these crucial conversation techniques. Once the participants have finished practicing, the facilitator would debrief the class on learnings. Where did they struggle? How did their conversations go? What would they do different next time? This exercise is expected to take approximately 30 minutes. The final objective and activity of the class is to provide the participants with some guidance on how to have proactive conversations with their people. In their 2021 Harvard Business Review article, Unconscious Bias Training That Works, Francisca Gino and Catherine Kaufman explains that bias training needs to help employees act on their awareness of bias. According to Gino and Kaufman, encouraging people to keep reflection journals documenting their thoughts and feelings when they have acted out on bias. This can help people recognize their biased behaviors and identify how to behave differently as a way to remind them that they hold the power to change their behaviors. Leaders can also encourage people to put themselves in others' shoes to create empathy. Finally, leaders can offer mentors and encourage solicitation of feedback to identify instances of bias in the work setting. This concept is also reinforced by Kim Scott in her 2021 book, Just Work. The class participants will be asked to reflect on what they have learned throughout the class and craft an action plan on how they will discuss bias with their employees. Then they will share key actions with their table mates to get feedback on their plan. After the participants have completed their discussions, the facilitator will have a debrief and ask participants to share elements of their plans and verbalize their commitment to execute their plans. This activity is expected to take approximately 30 minutes. We will now discuss the evaluation method. The Kilpatrick's 4-level training evaluation model was utilized to determine the effectiveness of the training and what necessary steps to take to ensure that the appropriate practices are implemented to reduce biased behaviors within the workplace. The expectation is to obtain longevity of a successful outcome through the establishment of a solid foundation, measuring the effectiveness of training, encouraging better decision-making techniques, and review and rethink practices if applicable. We will take the following steps to ensure that the intended goal of the training is a success. The development of the foundation by collecting data from employees and groups regarding unjust experiences that they have encountered. This information will assist in the selection of the appropriate training topic. Participants were encouraged to provide feedback on his or her learning experience at the end of the session. This provided insight on how well students were engaged throughout the training. Participants that were impacted by biased behaviors will be asked to disclose their experiences through surveys before and after the training. This will assist in the measurement of effectiveness of the training as well as providing confirmation on whether significant change in the behavior has occurred. The establishment of better decision-making strategies will be implemented. One of the strategies will entail the encouragement of supervisors to refrain from elaborating on personality traits of employees during performance evaluations. Policies will be reviewed and revamped that may have played a major role in the biased behavior. In conclusion, we see the importance for leaders to be able to break bias amongst their workforce individuals. Some of the ways leaders can do that is by understanding what bias is, practicing and being able to identify bias, examining their own biases, whether it's through the implicit association test conducted by Harvard University or other means, and lastly, by practicing correcting and preventing bias in the workplace. We encourage you to use the reference cited here if you would like to explore in more detail some of the information used to develop the concepts and proposal for the training that we have just discussed. I am Jose Barrientos, representing Group 8 for the second fall 2021 session of LHRD 7305. My fellow team members are Lakeisha Alexander, Gabriel Diaz, Carrie Lara, and Rebecca Seaman. Thank you for your time and your attention.